Hey, it's Dr. Brian McKay from Neuropathy CoreHealth. I'd like to discuss with you today is the use of PEMF for neuropathic pain. Now, what exactly is PEMF? It stands for Pulsed Electromagnetic Field Therapy. And there are studies that show that the use of PEMF for neuropathic pain has been effective. Let's go over a couple studies right now. I'm referring to a study that was printed in PubMed, and explains as the evaluation of the efficacy of pulsed electromagnetic field in the management of patients with diabetic polyneuropathy. Put simply, diabetic neuropathy, polyneuropathy, it's really the same thing. And this study was done a couple of years back, and what it shows is that low-frequency PMF can be used as an adjunct in reducing neuropathic pain as well as for retarding the progression of neuropathy in a short span of time. Now, the question is, why haven't you heard about this as before? The problem with neuropathy is right now, neuropathy is a comorbidity typically of cancer treatment, exposure to toxins, alcohol use, or diabetes. So you have an underlying medical condition that is prevalent and needs to be addressed. The neuropathy occurs typically in the extremities, the lower extremities being the feet and primarily the hands. And the reasoning is that these are the areas furthest away from the heart. So what we see typically for these people is where they have an immune system that's compromised, and now, to make matters worse, their blood flow is not of the same volume it was before. So it's harder to get blood to the area. When you have trouble getting blood to the area, the nerves, which also have blood flow going to the outer part of the nerve, will start to become more hard, and it shrinks up, it shrivels. There's lack of blood flow. This creates quite a serious problem because now, in addition to having to take medication for your underlying pathology, now you have to add another one in. And the medications are typically anti-seizure medications. I'm sure you've heard of them before, like Lyrica, Cymbalta, GabaPentin. And these are commonly prescribed medications for neuropathic pain, shingles pain, and stuff like that. But they come with a serious side effects. Some can make you lightheaded. Some make you gain weight. But the bottom line is they're just not an overall effective way. And Neuropathy CoreHealth has a program where we use several different modalities and we combine them on different treatment sessions to get effectiveness. Now, if you really want to learn about PEMF and not listen to this podcast, I just suggest that you go into YouTube and look up Dr. Oz PEMF. It goes into a really good explanation that I can't give you right here today, but it'll show you visually that we're not going to get with today's lecture. So the reason why we stack different therapies is because we've been able to help people with neuropathy. We've been doing it for several years. It's a more natural approach, and the idea is, can we make the quality of life better? Because you really can't cure neuropathy. Neuropathy is not something we claim to cure, but with the right protocols, we're able to have people gain feeling back in their feet and hands, primarily the feet, though, with diabetic neuropathy and chemo-induced peripheral neuropathy and toxic-associated peripheral neuropathy. So in doing so, the pulse electromagnetic field therapy supercharges the cells and allows for that cell membrane to become more efficient with the right charge across the membrane surface. So think of a balloon as a cell. You have certain nutrients that need to get inside the balloon, and you have to have certain stuff get out. You got to take the garbage out, let the good stuff in, the nutrition in. And so what happens is you lose efficiency of the cell membrane permeability when you have existing underlying pathologies such as diabetes or cancer. And now the cells become less efficient. By charging the surface, the membrane surface, with pulse electromagnetic field therapy, or PEMF, we are able to allow the body to operate at a much higher level of functioning. And so that really is one of the main goals of the PEMF, is why it's one of the treatments that we offer here at Neuropathy CoreHealth. So another study I want to point out is again in PubMed, which is the National Institute of Health's site for publication of different studies. And this is a pilot study with PEMF for neuropathic pain in people with positive electrodiagnostic studies like needle EMG or needle nerve conduction velocity tests. And so this study had shown that pilot data demonstrate that directing PEMF to the feet can provide unexpected short-term analgesic effects in more than 50% of the individuals. So that is really a high number, considering that the medications don't even come close to touching it. Now, here's why I like to use PEMF for our neuropathic patients. The short-term relief allows the person to get more active. Typically, we see that patients with neuropathy are much less active because it hurts their feet, hurts to move. You can't feel your feet. And in doing so, we are then able to build up the person to where they can start doing more active exercises to get the blood flow stimulated. Now, a whole nother topic is whole body vibration to stimulate blood flow to the extremities is another modality that we use, but we're not talking about that today. So it's almost like we can take someone who's sitting way too much, bringing them about a higher level of functionality to where that next therapy kicks in and really makes a difference. So the Neuropathy CoreHealth program is very complex, I'd have to say, but it is some of the stuff we have you do at home with nutritional recommendations. Again, that's another day for another topic. I mean, the B vitamins of utmost importance, acetyl carnitine, your omega 3s, your omega 6s. These are all very important nutrients to have in your body to help strengthen the body to work better. And immunocompromised people, like people who are diabetics or chemotherapy patients, this will serve them in many ways, because the adequate nutrition that can get absorbed makes your body more effective. And when you make your body more effective, we hopefully can help minimize the detrimental effects of the neuropathic pain. I'm Dr. Brian McKay of Neuropathy CoreHealth. If you have any questions, you can feel free to reach out 203-875-0846. 203-875-0846. PEMF is a very good modality to use. It's safe, it's comfortable, and we hope to see. If you have any questions, feel free to give us a call. Have a great day. This is Dr. Brian McKay from Neuropathy CoreHealth.